Are you looking for continuing education from a Canadian provider?
Executive Links has almost 200 webinars to choose from on many topics including med-surg, critical care, geriatrics, peds, mental health, and more.
Each webinar is $35 and includes handouts, a certificate of completion, and the option to watch live and on demand for at least a year.
Save 15% for the rest of 2022 on any topic.
Just use code GRITTY at checkout.
Visit execulinks.net to register. That's execulinks.net.
Is this thing still on?
I think they can hear us a bit better now. Should we keep talking?
Of course. Let's say it louder for those in the back. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion about health and healthcare. My name is Amie Archibald-Varley.
And my name is Sarah Fung.
And we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, YouTube, iHeartRadio, or any other podcast platform, don't forget to hit subscribe so you can get updates on new episodes.
If you love our podcast and our advocacy work, please go to www.grittynurse.com and click on the Support Us button. This will give you access to exclusive episodes and early releases on a monthly basis.
This will help us with the cost of running the podcast, the time and energy to put out awesome and informative episodes. And for that, we thank you and we appreciate you.
Hi and welcome everyone. Thank you so much for coming and joining us again on the Gritty Nurse Podcast. I think we have a lighthearted, funny episode. We need to have those every once in a while. Yes, we do the grit. Yes, we talk about the issues that matter, but this is an issue that matters too. And I think it's nice to have these lighthearted episodes. And as much as it's a very serious topic, it's actually it's crazy. The story that we found is crazy. So before I say anything else, Sarah, why don't you take it away?
Okay, so this story is really funny because it was actually brought to our attention by Bruce Sackman, who you may or may not know as a former guest of ours. He was the author of a book called Behind the Murder Curtain, and he brought this story to our attention. And the more he told us about it, the more I thought, truth really is stranger than fiction. And in this case, I don't think you can make stuff like this up. So we're going to tell you a story that is quite shocking and surprising and a little bit unbelievable, but it did happen. So, Amie, why don't you start by sharing the story?
So this story actually takes place in the US and actually happened in Connecticut. And it's about a woman who pretended to be a nurse and actually even staged her own Nurse of the Year party in 2008 and was later sentenced for criminal impersonation, practicing nursing without a license, and second-degree forgery. So Betty Lichtenstein, 57, had no real medical training as a nurse, but dispensed medical advice, wrote prescriptions, and administered shots to patients as if she had a nursing license. And the state's Medicaid Fraud Control Unit began investigating after a patient complained about Lichtenstein because she actually injected the patient with medication too quickly, causing pain.
And where this starts to take a little bit of a turn is she was investigated by the state Medicaid Fraud Control Unit between March and August of 2009 due to this complaint. And she was charged with illegal use of the registered nurse title, 6 counts of second-degree reckless endangerment and criminal impersonation. And 3 months earlier, she was actually arrested for forging a prescription for painkillers for 96 oxycodone pills she obtained while pretending to be a nurse for Dr. Gerald Weiss in Norwalk. And this is the part that is really interesting. So, what they had found out is that a year prior, so in November 2008, she received the Nurse of the Year award at a dinner she supposedly hosted by the Connecticut Nursing Association. And here's the funny thing, this association does not exist. So she threw herself a fake award by a fake organization, and she had an awards dinner with no less than 41 guests in attendance. So she convinced over 40 people that this was not only a real award by a real organization, but she was the person deserving of this award. And at this Medicaid fraud control unit, they determined that not only did no organization exist, but she had spent $2,000 to stage the event. And she gave herself, I don't know if this part is real, but she was to receive $10,000 in a personal award, and an additional $10,000 was to go to the charity of her choice.
Yeah, like that is so crazy. I mean, I think the fact that this nurse, or sorry, I shouldn't say that. I think the fact that this individual who was posing for a nurse decided to throw herself a party, like I think this is where I really have, well, there's concerns about the story in general, but the fact that she thought she would get away with throwing her own party of a fake institution, of a fake, like a fake nurse. Like I don't know how she didn't think that she was going to be found out. But anyways, so yeah, the craziest part is she did end up taking a plea agreement where she agreed to serve up to a year in jail, and she actually pleaded guilty to reduction of charges, so lesser charges. Those that she did not plead guilty were all but dismissed. And during the sentencing hearing, her attorney, Lindy Urso, acknowledged that the case had held some bizarre set of facts, which many said could not be explained. But she also said Lichtenstein thought that the particular doctor, so Dr. Weiss, the doctor that she worked for, was also complicit in the charade, especially because he was the keynote speaker at the Phony Awards dinner. Like, I don't know what was really going on in these individuals' minds, but it's actually quite concerning.
And the thing is, the other part that the doctor played is that he told the judge that that Betty was in very bad health, and any sentence would be a quote unquote death sentence for her. He said that she had a pacemaker, a deteriorating heart muscle, congestive heart disease, and diabetes. So the judge that was on this case, State Superior George Bruce Hudock, said that those who go to doctors and nurses expect the best treatment possible from those who are qualified. By putting yourself up as something you were not and were never, you endanger the community, he said. This quote unquote nurse could have no contact with this doctor, his employees, or his patient. He also forbade her from seeking employment in any area related to the medical field, and she was to inform in writing any potential employers of her convictions.
Yeah, so I mean, let's actually talk about this particular case. And I think this is where, we have to really pull out some of the very serious concerns here. And I think one of the biggest things that we need to do is take patient complaints seriously. I'm pretty sure that probably wasn't the first patient that complained about the type of treatment that they received, but that particular patient who did complain, they ended up having like issues with the injection and much pain at the site. And again, I guess that also goes towards technique, because as nurses we are actually taught like the Z track method and other ways of making sure that when we're giving injections, that one, that they aren't painful. Yes, there will be some pain because of the needle, but the intention is to make sure that we're providing treatment, and then we do our education piece while doing this. And I mean, I'm really concerned that the fact that this seemed to actually go on a lot longer than it did. But again, I think the main key takeaway is we really want to take people's complaints seriously, and I'm glad that someone took this patient's complaints seriously.
Yeah, and just for hiring managers and organizations in general, I don't know how it works in different states, but there should be at a minimum a background check to make sure that number one, you have a license, number two, that there aren't any active complaints against you, that there aren't any restrictions to you working as a nurse. I think that's just basic, but maybe in some cases we've heard in other other stories involving physicians that some places are just so desperate for nurses that they maybe overlook this step or take people's word for it when they say that they're able to work as a nurse. And that's really dangerous because I don't think it should be up to patients and families to police this kind of thing. They go into a hospital or clinic expecting that the people working there are medical professionals.
No, absolutely. And I think the other piece that I want to kind of pull into this is although we have a shortage, and I actually am quite concerned about this because, we have a nursing shortage. And I think this has been something that we've been talking about for a very long period of time. There are a lot of people who have tried to get into nursing, tried to get into the profession, and it's actually quite difficult at this time. You would think that with having a nursing shortage, it's easier to get in or that they would open up the application numbers. Well, that actually hasn't changed. Nothing has changed in that regard in terms of saying, okay, we have this problem. How are we going to circumvent the problem? How are we going to make sure that we have more skilled workers in this program? They haven't done anything. All to say that it's concerning the fact that people might say, "Hey, well, this is, a surefire way to be employed." If there was anybody who didn't lose employment during the pandemic, it was nurses. Like we had probably more work than we could actually manage. And the concern is the fact that it sounded like this individual had been doing this for a long time, and I don't want people to get the wrong ideas to think that this is something that can easily be done or should be done at all. And I think that there has to be repercussions. I think, they gave her a year, but there should be some real severe repercussions for people who are pretending to be healthcare professionals because she could have caused a lot of harm.
Yeah, absolutely. And I think that another thing is, at least in our neck of the woods, the College of Nurses of Ontario, which is our governing body for nurses, views the word nurse as a protected title. So, in terms of the titles you can use, nurse, nurse practitioner, registered practical nurse, in some other provinces might be licensed practical nurse. These are protected titles, and anyone calling themselves a nurse without being registered with the college is considered an illegal practitioner and can be prosecuted under the Regulated Health Professions Act. So it's not, I guess maybe in some parts of the world, the word nurse can mean many different things, but here it's a protected title. Just like if someone said they were a medical doctor and they had not gone to medical school, that's a serious thing because even with everything that's happened, nurses are still in a profession of trust, and we have a level of responsibility and leadership that we need to hold ourselves accountable to.
Absolutely, and I think here's like the little insider's tip for those who are listening that aren't healthcare providers is you can actually like find a nurse. You can actually go on to our registry body and actually type in our names and get that information. And I think that's actually a really powerful tool that the public actually has access to because at the end of the day, nursing and all of those different terms that you kind of laid out, Sarah, they're protected titles. And again, if you are mistreating or your nurse is mistreating you, or you feel that the care that you received isn't adequate or is poor, the process is that the College of Nurses, for example, in Canada and the States, the regulatory body is actually to protect the public. So the fact that we're all registered, we all have to be listed in this database, in this, and it actually will tell you what restriction, if there are restrictions, if there has been disciplines on these nurses, whatever the case may be. And I think that's a powerful tool in terms of, if you are a member of the public and you feel that, you've had this experience and you want to make a complaint, that is the board to complain to. And that is also a way that you can actually type in a nurse's name and find out that information. I know that, and I'm sure this is a practice that you probably had too, Sarah, where, so for example, you've probably done this too, Sarah, where, we work in whatever clinical area that we're in and we have our badges and we just notoriously just hide our names. And I don't think we hide our names because we don't want people to know our first and last names or whatever the case may be. But there has been times where nurses have been, targeted harassment, abuse, and it makes us fearful. So, we do have badges that have our first and last names on them, but some people will cover them up. And I think that's just something that we do. But at the end of the day, if you wanted that nurse's information, you should be able to ask them and receive this information. And you can, like I said, you can actually look them up on their registry board. And I'm super surprised that this employer didn't actually check. Like it's really bizarre.
Well, yeah, and I kind of wonder if it's because it was a private physician's office versus a hospital where things might be a little more lenient. I don't know what the dynamic is or was between the two of them, but I just want to go back to this whole awards ceremony thing. For someone to have the
Yeah.
audacity to not only pretend they're a nurse, like I would be scared out of my mind, by the way, if I wasn't a nurse and just even the thought of pretending to be something I wasn't would have like shot my nerves to hell. But then to have the audacity to fake your own awards ceremony and give yourself an award, I just wonder about all the people that attended. Like, did this raise any red flags for them, or were they just blindly going because they wanted free food?
I
Like,
was gonna say free food, Sarah. I
that
was like,
you
free
know that
food. They're
gets
just
me
like,
anywhere.
yes. Well, I mean, yeah, that's a perfectly reasonable question. And I think that, you say that you and I would be fearful. I think this individual clearly wasn't thinking or felt that, they could get away with this. And I guess that I guess separates the logical mindset from the criminal mindset, right? Like, she intended to deceive individuals. She intended to not be caught. She intended to practice in a way that she put people's lives at risk, and she was okay with that because she knew that she didn't have the license. Like, this was a deliberate act. And I mean, I hate to bring this up again, but this is where, again, we talk about Redonda Vaught, and we've talked about her case previously on this. And there's discussions around, the criminal prosecution of this nurse for negligence. And again, we're not disputing the fact whether she was negligent. I think we were disputing the fact of intentionality and whether this individual should go to jail, and whether that we should set a precedent for medical errors that individuals go to prison. This particular nurse, it was intentional. Like, well, sorry, she wasn't a nurse. This particular individual who's pretending to be a nurse, her actions were intentional. They were malicious. She knew that she could be putting individuals' lives at risk. And this is where I personally think that the fact that she got a 1 year jail term and then it was reduced to lesser charges, I think she got a smack on the wrist. I think what she could have done, um, is just as devastating as, what kind of happened with this particular case with Redonda Vaught. But I think, just kind of to circle my thoughts, is really just to say, I think that we should be looking at intentionality versus unintentionality. But that's just my opinion. And I mean, I'm one opinion of how many opinions that we've seen. But again, just circling back to this particular case, I think they slapped her on the wrist with a lesser sentence. And what was it, like
Hmm.
1 year of jail time or 9 months of
Yeah,
jail time?
it's just cases like this that make me lose a lot of faith in the legal system, which is I realize this is a whole other topic, but it just when you put the cases side by side like that and you think about what Redonda Vaught did, which was an honest mistake, which unfortunately resulted in a very catastrophic outcome, versus this nurse who intentionally deceived the public, who intentionally called herself a nurse. She had no medical training whatsoever and decided to throw herself an awards dinner where she's giving herself an award. The doctor she's working for is speaking up on her behalf. And to just get away with that, just like a slap on the wrist, like it was nothing. It just makes me lose a lot of faith in the system. But of course, we don't know all the details. It's just this is how I feel, and I'm sure other people feel the same way, that she should have reduced it, or she should have received a much harsher sentence given what she did. Even though, who knows, maybe she did cause more harm, but we just don't know about it.
Yeah, I mean, I think it's hard. Like, again, like you said, it's really hard for us to kind of try to pinpoint exactly the type of harm, or if she has caused any harm, because we don't know. We don't know the all of the different types of patients that she kind of interacted with, and kind of what their results were, because I guess they haven't come forward, and whatever the case may be. But again, I think it just begs to question why anybody would do this. And I think, just as, a healthcare professional, there's so much effort and so much education and so much knowledge that comes into being a skilled nurse, right? It's not just, and I think this is the other takeaway that I want to put out there. This is like, nursing is not a job that you could just off the street go and do. I think this particular individual, she picked a doctor's office, and clearly there had to be some type of relationship there. Something doesn't seem right to me with this physician hiring her, not like looking into all of these things and then kind of protecting her at the end. I mean, I think that I want people to really understand that nursing is a STEM, it is a skill. So it's not just, you can't just all of a sudden walk from, out of a store and just like, I'm going to be a nurse and start practicing at that moment. Like, I think there's 4 years of education for those of you who may not know in terms of a bachelor's degree. And then nurses sometimes take on additional forms of education, whether they want to specialize in the operating room or whether they want to specialize in labor and delivery or the emergency department or the ICU. That can be an additional 6 months to 2 years of education. So I really want people to understand that nursing is a skilled profession. We're not just wiping bums or just giving injections. There's a lot that comes with nursing in terms of understanding what's happening with the patient. I'm understanding, looking, not just being able to look at the patient, but understanding physiologically what's happening behind the scenes, and then also to make a judgment what you might need to do next in terms of their care. So the fact that this person was able to get away with this, it's very concerning. But again, I can tell you, and I promise you, those that are listening that are going to receive care, that the people that are supposed that are nurses, that are truly nurses, are highly skilled individuals.
Yeah, and this is a really this is a really uncommon situation. So I don't want people listening to think that you should doubt the fact that your nurse is a regulated healthcare professional. But I also want to point out the fact that if you ever feel uneasy about something, don't be afraid to ask questions, because I have a hard time believing that every single person that attended this awards dinner didn't question the fact, is this association even a real association? Because a simple Google search would probably, I mean, I think it would have told you whether it was or not, but I'm sure people just kind of brushed it off and didn't think much of it. But I think just in general, don't be afraid to question things and ask, is this really what it is? Or do your own research before blindly attending an award ceremony or being part of something that doesn't seem to add up, right? It seems like a lot of money to receive for an award, to be honest, for something that's not really prestigious. And, it doesn't involve research or scholarship money in a more official capacity.
Yeah, like honestly, this whole this whole situation is a hot mess. Like I don't know how they didn't catch it like many, many, many months ahead. Just listening and looking at the story, it's a hot mess. I don't know how it slipped through the cracks, but for whatever reason it did. And again, actually just goes to show that, we have more work to do on our end to make sure that individuals, we are protecting our patients and families that are coming to receive care, making sure that the people looking after them are competent, they're skilled, they're up to date with their knowledge, whatever the case may be. And I think that private or public forms of healthcare, they still have a due diligence to make sure that their patients and families are kept safe and kept safe from people who are coming in to do shady kind of shit. So, I mean, at the end of the day, I'm glad that they caught her, but there's work to be done on the healthcare avenue and aspect too. And the other thing is, I don't think she was the only person who's ever faked being a healthcare professional. We've heard about doctors. Oh, sorry. Again, let me correct myself. We've heard about people pretending to be physicians as well. Other healthcare areas. It's just it's just really bizarre. And again, we just have to make sure we have quality measures that we prevent this from happening in the first place.
Absolutely. And I think just bringing awareness to certain cases, like back in 2008, I'm sure social media was not as big as it is now, but if this ever made it onto Twitter, like in this day and age, I think it would just have blown it out of the water 10 times more.
Yeah, no, absolutely. And I think these stories should be shared. And I think, I think to myself, I wonder where this individual is now and what they're doing now, and if they even felt any remorse. And I think one of the things that we saw in the various different articles is the only thing that she said when she was going away, when they were taking her to prison, was "I love you." And I think she said that to her daughter. So no even remorse, which is even more messed up, because she didn't even say like, sorry that I did this. She just kind of was like, oh well, I got caught, love you, peace out, I'll be out in like a year. Which is it, again, that's why I said I think it was a slap on the wrist and very, very scary.
Yeah, and there was one other fact that I forgot to mention. There was one article which actually said she had 20 bottles of medication that she was bringing with her to jail. So I kind of wonder about her intentions. Maybe she faked being a nurse because she wanted quick access to medications. And the fact that she was caught, trying to fill a fake prescription for narcotics, it just makes me wonder, was that the real reason why she did this, or were there other reasons that we don't know about?
This is a whole other podcast episode, but when it comes to medications, like, I hate to say this out loud, people steal shit. Like, I'm not even gonna lie. Like, people steal stuff, and I think when it comes to talking about narcotics, so like oxycodone, fentanyl, and these different things, they do go missing. There is a lot of checks and balances that people put in place in terms of like narcotic counts, putting them in locked, locked. Oh my gosh, what are they
Cupboards,
called?
like
Well, it's not.
Pyxis.
They're. I was gonna say Pixis, but people won't know what that is.
Well,
Putting
like the Redonda Vought case, it was in an automated dispensing
Yes,
cabinet.
okay.
Yeah.
So like, for example, like putting them in an automated dispensing cabinet so you can actually see how many goes in, goes out, but there still is room for human error, and this is how obviously, pills and these things go missing. And I think if, oh my goodness, if I think that, what the street value of something like oxycodone is, I think it's actually quite expensive. Like oxycodone, Percocets, and these things are actually, the street value is actually quite high, and I think they're kind of like a rare commodity. So, or, I guess I wouldn't say rare, but I think it's a highly wanted commodity. Anyhow, yeah, but like, on the street value of these types of drugs are high, and people, and there are still people that want to use them. So I mean, I guess if you already have a criminal mindset and your goal is criminality, stealing drugs from a hospital is probably like your next your next step, because obviously you can make money doing that as well. But
Hmm.
this is why I said healthcare just overall has so much work to do in terms of trying to change the system in general. I think the way that we've been doing things for a long time have not worked, and we still keep doing them, which is actually the definition of insanities. But circling back to the whole aspect of the drugs, I think that's just, again, her criminal mindset. She saw opportunity and she decided to take it.
So we just want to let you guys know, listening, that if you have any similar stories, we'd love to hear them, or let us know what your take is on this particular incident and this person who was faking themselves as a nurse.
Yeah, I mean, again, we always love to hear interesting stories, and so thank you again, Bruce Sackman, for sending us this very interesting story. The main takeaway I'd want for people that are listening is, if you feel like something is off, or you feel like the individual who might be caring for you is not caring for you adequately, or you think that, you might have asked a couple questions and something seems wrong, you probably should go with your gut feeling that something probably is wrong. And again, you have the right to know your nurse's name, first name, last name, and you also have the right to check them out on their regulatory board. And I think that's an absolutely perfect and an okay thing to do. So again, just making sure that we're keeping patients and families safe. I think that's the main thing that we want to happen in healthcare.
Absolutely. Thanks for listening.